My name is Tracy Mullis. I'm a nurse practitioner. I work with the Department of Nephrology at NEA Baptist Clinic. I started in 2016 and received my certification in hypertension in 2018. Along with Dr. Adam Woodruff, we've worked to develop a hypertension clinic to give better access to the community for this widespread problem that we know is happening. Hypertension is really prevalent all across the country, but particularly here in Northeast Arkansas and along the Delta. About 52% of our population has high blood pressure. So when we started looking about what we wanted to do with this type of practice and what kind of asset would we be to the community, we wanted to give better access. We wanted to be a place where you could go to get better education about hypertension. We wanted to give a good way to communicate, not only with our clients, but for our clients to communicate with us. And hopefully all three of those things combine and we give better outcomes in regards to getting people's blood pressure controlled. One of the newest technologies that we're proud to offer through the NEA Hypertension Clinic is something called our Withings device. Withings is a company that uses modern technology and science and kind of marries them together. And our Withings monitors are small and compact and easy to use. They use Bluetooth technology to transmit blood pressures that you take at home directly to your MyChart. And so when we use the Withings, we help you get it set up, we teach you how to use it, and then all you have to do is go home, put it on, push the button, and know that your blood pressure is going to be sent directly to your MyChart for me to be able to see. So when we talk about better access and when we talk about better education and communication, all three of those things go together and hopefully give better outcomes. We've had a lot of success in treating resistant hypertension or poorly controlled hypertension that has been present for a long time. And I think that the reason that that happens is because it is this sort of comprehensive visit and comprehensive care that we're providing. I have some people that I see and we make these small adjustments either in their medications or identify a class of medication that they've never been on that was kind of the missing part of the regimen. And sometimes we get their blood pressure controlled and stable just in a few weeks. I do have some people that have had blood pressure problems for a long time that we get them controlled, but because of their history and because of other issues that they've had, we do continue to follow them for long term. So when we started looking at how to create better access for people who had hypertension, our first target was to go where people already were going, and that was to our primary care providers. We have a great working relationship with them and actually allow for same-day referrals for people who show up to their doctor's appointments who have extraordinarily high blood pressure and who otherwise would probably go to the emergency room. Those people, if they're not having symptoms, can actually come to our clinic and get evaluated. Access also includes self-referrals. There are some people who know that they've had high blood pressure for a long time and have been struggling with it and haven't been able to get control. And those people can call, just like they do for any of the other NEA providers. They can call our clinic and they can request a self-referral. So the second component of our clinic, the way that we want to model this clinic, is better education. So when you come see us at the Hypertension Clinic, whether it's me or Dr. Woodruff, we're going to go through everything. A comprehensive review of not only your past medical history, but what medications you've been on in the past that maybe didn't work and why they didn't work, what you're currently taking. We go through your family history. We do a lot of talking about modifiable and non-modifiable risks, because there are things that I can help you with, like diet and weight management and sort of lifestyle modification that we can kind of hone in on. We can control those things. We also go over the non-modifiable risks for hypertension, like race and age and gender. And so we kind of look at the person as a whole rather than just you have one problem you're seeing before. We look at the person overall and we really try to make targeted decisions and individual plans for everybody that walks in through the door. And then before you leave, I'm going to show you how to take a proper blood pressure. We're going to talk about body positioning. We're going to talk about appropriate size of cuff. We're going to talk about what's normal for you, what's not normal for you. When should you go to the ER with a certain level of blood pressure? You're going to get all of that information whenever you come into your appointment, and hopefully leave with a better understanding of why you came and what our plan is going forward. So the next part of our process is going to be, okay, you've gone through your appointment, and now you have all this education, and now you've got medication, and now you're going to go home and you're checking your blood pressure, and what do? People always have questions. They always have questions. And so here at NEA, we have something called MyChart, and it's actually through the entire Baptist system, and it's an app that goes on your smartphone, and what it does is it allows you to directly communicate either with me or with Dr. Woodruff or with one of our nurses about any questions you have or any problems that are going on. And what I have people do is I really kind of give them some homework. So when you come see me and we make all the changes that we're going to make, I ask you to check your blood pressure, because me checking your blood pressure once every couple of months is really not going to do you any service. So you go home and you take your blood pressures. What do you do with them? You're going to send them to me through MyChart. What that allows me to do is do a comprehensive review of not only what the medication is doing, but how you're reacting to it, and then we can make some small changes over time that really make a big difference. What patients love about this is that it kind of takes the waiting part out of the game, because you can use MyChart and send a message, and then I can send a message back to you, so you don't have to sit on hold on the phone. So it's a really, really good tool to use. It's very effective, and not a lot of hassle to get in touch with your provider. So if you have any questions or want any more information or want to schedule an appointment with a hypertension clinic, what you can do is you can call the main number for the clinic. It's 870-936-8000. That will get you to an answering service, and then you just request Hypertension Clinic, and that gets you on the schedule either with Dr. Woodruff or with myself. And again, my name's Tracy Mullis, but we hope to hear from you soon.